Hi, I was told I would find you here. Are you Lily?
I'm Lily, and they told me to wait right here.
Yes, it's so nice to meet you. I'm Kelly Henricks.
Nice to meet you.
I'm a nurse practitioner and I work with the Palliative Care team here at the hospital, and I'm taking care of John. So the reason I'm here today, I work in conjunction with John's primary doctors that you've probably already been talking with the last few days since he's been here.
Yeah.
But they asked me to come and talk to you today and make sure that everybody's on the same page in terms of our goals for John and his care while he's in the hospital.
Yes.
And I first really want to hear about your brother, John. Could you tell me more about him?
Oh my, I'd be happy to tell you about my brother. He's my baby brother, you know. And, well, I'm 5 years older than him. He's my only brother, and, well, we're quite close. He's a proud man, and as he should be. He served in the Army for 30 years. And, well, you know, because of that, he's got health insurance with the Army, and that's nice. Well, he was an infantry soldier. I don't really know what that means, but I'm proud of him, you know. When he was in the Army, he was in the Philippines, and he married the nicest young lady from the Philippines, and her name was Faye. Well, Faye passed away, many years ago. She was quite young, you know. Well, before they passed, she had twins, Bernie and Benji. Well, they're grown men now, and they're good men, you know, like their dad. Anyway, what else do you want to know about John?
Well, you say that he has 2 sons, and I notice I haven't met them yet, and they're not here today. And
They live local here. They don't live far, actually. Well, they love their dad, but they don't do well with hospitals. I suppose it's since their mom passed so young, and they just want their dad to get better, you know. And well, they rely on Aunt Lily. That's me, you know. I'm a retired nurse. I worked as a nurse for 45 years. Well, those boys I suppose they count on me when it comes to their dad.
Right. They're lucky to have someone like you.
Yes, we're all real close.
It sounds like it. That's wonderful.
They're nice young men, you know.
Well, something I was hoping to ask you about today, Lily, would be to tell me about your understanding of your brother John's health right now.
Well, I believe he's quite sick, isn't he? He's got the emphysema, and, well, he's had it for years. He smoked when he was in the Army. Well, people think that's a bad thing now, but back then, you know, all the soldiers, they smoked, you know. He quit about, well, I don't know, 5 or 10 years ago now. Anyway, when I brought him to the hospital, his oxygen was quite low. I think they said it was in the 70s. And, well, that scared me a bit, you know. He had some swelling in his legs. That was new. I hadn't seen that before. Well, I know they have him on the ventilator to help him breathe, but the doctor said today that they're taking him off today. They're going to try to wean him off that ventilator, and by tonight they're hoping that he doesn't have that tube anymore. Yes, it's just a bump in the road. And he gets sick quite often with the emphysema, but he's a trooper, and he bounces back.
Is that what you've heard from the doctors, Lily, that they think this time that he'll bounce back and that he'll come off the ventilator and get better?
They told me this morning that they're going to get him off that ventilator, and hopefully by tonight he'll be better, That's all they said this morning, but I go with John to every doctor's appointment. I'm always with him, He has no one else, really. Well, it's a bit confusing, Every doctor tells me something different. Sometimes the doctors act like they don't want to talk to me at all, and, maybe because I'm old, I don't know. If they know I'm a nurse, maybe they assume I know everything. Or maybe just because I'm his sister and not his wife or his kids, they don't want to talk to me. But at any rate, I get a bit confused because I get different stories all the time.
What I hear you saying, Lily, is that maybe you're ready for someone to talk a little bit more honestly about John's condition, and
I would so appreciate if we could just have an honest, clear conversation, If somebody would really tell me what's going on, and don't try to just sugarcoat everything,
Yes.
Yeah.
Well, that is part of the reason why I'm here today, and I would like to have that conversation with you, if that's okay.
I would be so happy.
Good.
I appreciate you.
Well, Lily, John is getting sicker. And when he came into the emergency room 3 days ago, as you said, his oxygen saturation was in the 70s.
Yes. And that was with his oxygen cannula on his nose,
Right. And like you said, he had swelling in his legs.
Yes, I don't know why that is.
Yeah. So, you know that he has some pulmonary problems, some lung problems from his history of smoking. And, although he quit, which is wonderful, the trajectory of that illness is that it will continue to get worse. And his lungs are getting sicker.
Yes.
And when I look back in his chart and I see that, he's been in the hospital 3 times since the beginning of the year with problems with pneumonia or emphysema problems.
Yes, he gets the bouts of the pneumonia.
Right,
Yeah.
right. Well, and that unfortunately exacerbates his emphysema, or it makes his emphysema worse. And I know that he's bounced back, as you said, each time that this has happened, but judging from the ER notes this time, his illness has definitely progressed. And the swelling in his legs is because his lungs are so sick, his heart is having to work very hard to get the blood where it needs to go. And it's working against a lot of pressure in his lungs. So what's happened is the right side of his heart has developed what we would call heart failure, right-sided heart failure, and we confirmed that on an echocardiogram or an ultrasound of his heart.
Oh my, is that true?
Yes. Is that something you've heard?
No.
Okay. So when the right heart can't pump the blood adequately, the fluid tends to back up, and one of the places it likes to settle is down in the ankles and the legs, and that's why you're noticing that he was swollen when he came in.
It was in both legs.
Right, right. And so with that new problem and how low his oxygen saturation was, it's especially concerning to the medical team.
Well, thank you for sharing that.
And Lily, I'm concerned this time. It sounds like they're going to successfully get him off the ventilator this time.
Well, I hope so. They seem to think they could do that.
My concern is that next time we might not be able to do that.
Well, John wouldn't like that.
Tell me more about that.
Well, he wouldn't want to stay on that tube, you know.
Right.
He's a proud man. Mm-hmm. I know he wouldn't want to live on that tube.
What I hear you saying is that we might be at a point where we want to focus more on the quality of John's life, keeping him out of the hospital, versus the quantity or prolonging his life.
Well, that's what I would believe John would want, you know. Mm-hmm. But I know that Benji and Bernie, they wouldn't like that, you know. They want their dad to get better and go hunting.
I wish I could tell you that things were different.
Yeah.
And that I think that would happen. At this point, given the severity of his illness, I don't know that that's a realistic expectation.
I feel quite caught in the middle, you know. I know that John, well, he wouldn't want to live on the ventilator, you know. Mm-hmm. And I would want him to just be comfortable. But I would want Benji and Bernie to not resent me for that. They lost their mom, you know, and they were quite young. And, well, that was hard to get over for those boys, mm-hmm. and for John, you know. Mm-hmm. I don't know that this is a decision that I should make.
Mm-hmm.
Are you thinking that is this conversation because you think he needs the hospice?
I think that what you're explaining you would want for John, not being on a ventilator and being comfortable, and those things are in line with a hospice philosophy, and the goal of hospice is really keeping people comfortable out of the hospital, off of machines. And the difficult thing with hospice is that the physician team thinks that John would qualify if they thought he had less than 6 months to live.
Well, does he qualify?
I think at this point that yes.
Oh, my. I thought that John would get off that ventilator, and
Yeah.
well, he'd be back to himself. I so appreciate that you're talking to me so honestly,
And there's more tissues here if you
Yeah.
need them. I know this is very hard for you.
Yeah.
So you take all the time you need.
I don't think this is a decision, for me. I'm just the sister. Well, I'm a nurse, but isn't this decision for those boys?
Yeah, and I'm glad you brought that up. Do you know if John has a living will? Have you ever talked to him about that?
Oh, no, he doesn't. Every time we go to the doctor, and I always go with him, they always ask him if he has a living will, or they call it something else, don't they?
Well, part of it, yes. The document helps your brother to outline the care that he wants or doesn't want.
Yes.
And it outlines things like if he were to be on a ventilator, how long would he want to be on one before taking him off of the machine? And it asks some other important questions that are difficult to think about. But in this case, I think it would be very helpful for you and other interested parties in the family or friends circle to talk about who John would want to be his power of attorney. And in healthcare, we call that a POA.
A POA? What does that do?
That's the person that John can designate to make healthcare decisions on his behalf in the circumstance where he cannot. So, for instance, if he were on a ventilator and couldn't speak or unconscious. And it sounds like I'm hearing you're feeling overwhelmed and you're feeling a little bit caught in the middle. And I think having these difficult conversations and talking to his sons and John, hopefully when he's off of that breathing machine, when he can speak, that you can have this conversation and talk about who that person should be for John.
Well, I know those boys. They wouldn't want to make decisions like that. They would ask me to do that, I believe.
Lily, if John were here,
Yes.
what do you think John would say?
Well, John would tell you he's had a good life. And he's very happy. And, well, I know he wouldn't want a tube. And he wouldn't want people going overboard trying to save his life, I don't think. But I don't think that Benji and Bernie would agree with that.
Mm-hmm. Well, Lily, at this time, the paperwork that the physicians have and in the hospital is that John would want everything done. If his heart were to stop beating or if he were to stop breathing, he would want the team, the healthcare team, to perform CPR, which is the compressions on the chest.
Did he say that?
He didn't tell me that. But the paperwork that we have in the hospital is signed, and that's what we're following, and we are to do everything we can for him at this point. But it sounds like what you're saying is that you're not sure that John would want that.
I don't believe he would. But we need to ask him, don't we?
Right. My concern is that if John were to have an episode where his heart were to stop or his breathing would stop, and we were to do, even if we could do CPR and put the tube in, there's data that tells us that about 10% of patients after that, only about 10% actually leave the hospital
Oh my.
alive after that.
Is that true? It's not very many, is it? When I was a nurse, I used to have to do the CPR, you know. Oh, it's a hard thing to do, isn't it?
Some patients find that it doesn't feel like a dignified death.
Yes. Well, I think I told you that John he's a proud man, you know. I would want him to always have that dignity. Well, what do we do next?
Well, I think as hard as these decisions are, they're extremely important. And I'd really like to hear Benji and Bernie's thoughts
Yes,
and explain to them what I've explained to you today.
that would be nice. Would
About
you
John's
be able to do that?
I'd be happy to. I want to make sure that we're including John's sons and anyone else you think would be interested in helping us to make these decisions. And your brother John.
Yes, it would just be the boys. There's not anybody else.
And I can explain what I explained to you today to Benji and Bernie.
I would appreciate if you could do that. You're so kind, you know.
If you need to take some time to think about what we talked about and think about how you want to talk to the boys, I encourage you to do that. And these are difficult decisions and hard conversations. And I do think, though, at this point, given the trajectory of his disease, that we should try sooner than later to have the conversation.
Are you working tomorrow?
Yes, I am.
Yeah.
Would that work for you?
Yes, I'll call the boys. I'm sure they'll come.
Wonderful.